And this can be prevented also from getting this far if they see a dermatologist for checkups, correct?
Absolutely. So I always tell my patients that if they have a pimple that's not healing over a month, to come in and have it checked. I've had patients with melanoma as young as in their 20s. And obviously, you know, this is the least common skin cancer, but the most worrisome. But any of the skin cancers that we see should be treated because they're curative, and prevention goes a long way.
So if someone's looking in the mirror and they notice an abnormality that's been going on for more than 30 days, a month, like you said, that's a time to see somebody.
They should at least show it to a dermatologist who's board certified, at least have a peace of mind that everything is fine, and you know, be able to sleep at night.
Something larger.
Absolutely.
Yeah. So, you know, the sunscreen and these peels and these lasers that we have, tell us a little bit about how the laser works. To many of us, it sounds like outer space and, you know, some big machine is going to come right at their head and start firing lasers. Tell us about how these work and what are some of the applications you're using them for? Lasers
come in all different shapes and forms, and they treat a plethora of conditions. Red spots, brown spots, crepey skin, large pores can all be fixed. In the past, people knew lasers as probably the CO2 laser, which took off your whole skin, you healed for 2 to 3 weeks, and it was a major to-do. Now lasers are a lot more sophisticated, and they're able to give maximal results with minimal healing. They've fractionated the lasers, in other words, instead of taking off a huge layer of skin, we're basically hitting the skin in very tiny fractionated columns. This allows us to effectively treat any condition with very minimal healing.
So people can heal up rather quickly from this. It's done in the office as well?
Everything is done in the office, and we try to customize the treatment exactly to the amount of healing time the patient gives me.
So in terms of, you know, continuing to trying to look good, patients may be looking in the mirror saying, oh, I've got many, many pimples. Do I have acne, or is this just an isolated pimple out there? If this is going on for a while, what's the point in time where they should be saying, I need to see somebody for some expert care when it comes to breakouts or acne? What is it that you can do in the office, and when should they see someone like you?
So definitely, if any of your zits are leaving spots on your face, scars, red marks, or dark marks, you should come in and treat that, because I just read an article in one of our publications that they show how much prevention can go a long way in terms of prevention of scarring from acne, which is the big thing, right? We want to all prevent scars.
Right. People develop these breakouts, and then even though they think the redness has gone away, there's a spot that's left behind.
Correct.
So you can help prevent this?
Us educating the patient on how to take care of their skin. We review their home regimen. We do a skincare analysis, and we educate them on what products are okay to use, what products are not okay to use. People apply butter on their skin. People apply olive oil on their skin. It clogs their pores. So a little education goes a long way. We do some prescription skincare, and then we can explain to them how just little remedies in the office can make their skin beautiful and glowy.
Yeah, it's a common thing that I used to see in primary care of people coming in, popping their pimples and putting all these potions and lotions and all these things on their skin, and yet they were getting worse and worse and worse. And it's important not to ignore these breakouts, to make an appointment with a dermatologist like you who can clearly help treat this more effectively and prevent scarring and long-term damage. There was a term you brought up before the show that we talked about called Tekneq. And so I want to move away from skin cancer and acne into a new, maybe it's a millennial term. It's a more modern term that I haven't heard till today called Tekneq. I don't know if I have it. Maybe I have it. Maybe I don't. But what is Tekneq?
So research has shown that the average person nowadays looks at their phone, whether it's to check their phone or to check social media, roughly 46 times a day. Millennials look at their phone twice as much. So imagine this constant motion of looking down brings about some horizontal line and ages your neck earlier than was in the past, clearly before these common practices were instituted. And so we are seeing the neck aging much earlier. So there are things that we recommend to our patients.
Throw the phone in the garbage.
Well, at least
Not
hold
yet.
it like this. Don't look down like this.
Yeah.
Right.
It's only 46 times a day I'm looking. I think it's got to be a few thousand, but I must have
It seems
Tekneq.
when I look at my kids, it seems like it is in the thousands,
Oh
I
my
have to say.
gosh.
Yeah. So correcting those practices earlier and then doing some in-office procedures. We recommend all therapy, which is microfocused ultrasound, to make some new collagen earlier. Can correct those creases that develop from us checking our social media constantly. And then, again, doing a little Botox in the area, doing some fillers will help prevent this Tekneq. By the way, I have to thank Dr. Kim Nichols, who recently published an article about this Tekneq business and brought my attention to it because I was noticing the horizontal creasing happening earlier in my patients.
Wow, thank God I didn't take my boards recently. I would have to study on this new disease called Tekneq. But it makes real sense to me that, yeah, you're looking up and down, up and down. I know that between my practice, the phone calls I get in the office and the hospital, I'm probably looking down a few hundred times a day at my phone.
The emails, exactly.
Yeah, it's checking emails, writing back to text messages. Maybe I can counteract it by holding the phone up the other half of the time and looking up at the sky, or this is going to be a permanent problem here.
I think it's going to get worse and worse, to be honest with you.
Yeah, we rely on our technology way too much. I never thought that the phone would end up being a dermatologic issue, but you're able to go ahead.
It's the new disease.
Our viewers right now are guaranteed looking at their phones, Googling Tekneq, and Dr. Khrom here is someone who's able to treat those creases or lines that we're getting from checking Instagram every 5 minutes.
And I'm myself guilty as charged as well.
Right, everyone's trying to look beautiful on Instagram, and here we are checking out their pictures, making ourselves worse. My gosh, my gosh, Tekneq. Everyone watching today, Tekneq is the new disease of technology.
Yeah, coined by Dr. Kim Nichols, I believe.
There's an
I want to give her credit.
Right, Dr. Nichols has obviously done some research in Tekneq. I think I might be doing some research in Tekneq. Let's talk about some skincare tips in general. There are all these face washes out there. I mean, if you walk into a Duane Reade or a CVS or any supermarket, if you want to just buy some soap for your face, you can't just walk up and buy soap for face. There are all different brands that claim all different things. What do you recommend for your patients just to wash their face when they want to go to sleep or when they wake up in the morning?
Well, I like to do a skincare analysis for my patients because I don't believe that there is such a thing as oily skin, dry skin, combination skin. It's a very simplistic approach to look at skin types.
So it's not a one-size-fits-all
I don't
type
believe
thing.
so because not only are we genetically different, right? We grew up in different areas, received different amounts of ambient sunlight, et cetera, et cetera. So because of that, it's too simplistic to just call our skin combination or oily. After doing a skincare analysis and seeing the pore size, the pigment, the redness, I actually can recommend to my patients the best skincare approach. Once a week they can use an exfoliating cleanser, perhaps if their skin can handle it. And then we recommend a combination of an antioxidant or a pigment preventer in the morning, something to address their redness if they have some. And then, if appropriate, a retinol at night to help build a little collagen. So, I like a little sophistication to my recommendations, but in general, things that you can get in the drugstore from brands like Neutrogena, Eucerin, and Aveeno, these brands have done significant research and tested all their products, and just as a simplistic, early, getting a gentle cleanser would be fine.
Is there anything that, wow, I mean, face wash just seems so complicated to me, but is there anything you tell your patients to avoid? Are there habits that you see that patients are doing to their face to try to clean that you think are harmful?
They sometimes over-dry their faces with using an exfoliating face wash or scrub every day, which could be quite harsh. I would stay away from that for sure.
Over-drying the skin.
Over-drying the
thing.
skin or
Yeah.
applying oil on their skin.
Right.
Which is very
Trying
clogging.
to find that happy medium right in between is tough,
Right.
but it sounds like a skincare analysis by someone who's trained in this field makes a difference. I'm always frustrated when I walk in saying, I don't know what to use to cleanse with it. So maybe I need to come pay you a visit. You'll fix my Tekneq, you'll fix my brow, my Botox, and give me a face wash.
We will whip out our Visia skincare analysis, put a UV filter on you, give your skin, basically it can give your skin an age. So you'll know how old your skin is
I just want to be 29
versus
again.
yourself.
29.
Your skin may be younger than you.
You can dial it back with some of your treatments, though, it sounds like.
We can.
We really went into a lot of dermatology today, and for our viewers, it's really an honor to have someone like Dr. Khrom here. We talked a bit about skin cancer, not just sunscreen, but following up with a dermatologist to maybe help with those sunspots and the damage that's going on after Labor Day. So before Christmas, we want you to look good, under the tree or under the mistletoe, and then getting ready for vacation. It's important to see a dermatologist, someone trained in treating the skin. We talked a bit about Botox, injecting certain areas to make us look younger, to rejuvenate, or even to prevent.
Prevention is.
And we learned Tekneq, which is, I think the theme of this show is Tekneq. I'm so impressed by this problem, I think I'm going to go throw my phone out, and I'm sure the hospital.
Or at least hold it like
I'm going to hold, we're going to walk around like this, and I'll be the only guy walking around like that. I'll step into a pothole or something. And we also talked about lasers and these really neat devices that you have that maybe years ago took a lot of time to heal from, but are really advancing in technology. And patients can be treated in the office for all sorts of spots and veins that look abnormal or blood vessels that look abnormal.
Absolutely.
We only have about a minute or two left. What's one of your messages to patients out there watching today who really just want a good dermatologic analysis, dermatologic tips of, where should they go for care? What should they look for in someone's credentials when they're searching out a good skincare specialist?
So the take-home messages for my patients are avoid tanning beds.
Big one.
Use sunscreen on this upcoming Labor Day weekend. And then, look up the credentials of your patient. Make sure you're seeing a board-certified dermatologist or a physician assistant who is working with a board-certified dermatologist, and make sure you do a full body check once a year.
For skin cancer.
For skin cancer, And if any of your moles are changing, come in.
Yeah, I think that's really important. That Dr. Khrom really summarizes it, for us, is that see somebody.
Absolutely.
See a specialist. There's a lot of people out there gallivanting saying that they're doing laser and they're doing injections, but they're not like Dr. Khrom,
and to
who's
be
an
honest
expert.
with you, I have no problems telling my patients, I don't know what this is. And if I don't know what something is, I'll do a biopsy.
Right.
You need to have someone honest like that.
So once a year, get a skin checkup, just like we go to the doctor for blood pressure, for cervical screening, for breast screening, colon cancer, all these things. You're a key role here because skin cancer is the most common cancer. About 20% of people will develop one of these types of skin cancers.
Absolutely, especially if you're single and no one sees your back. Come in.
That's a good point. Okay, that's a key take-home right there. If you can't see your back, which we can't see 50% of our skin, that's correct.
Right.
See a specialist. Dr. Khrom, really, thank you for coming on. I learned a lot, and I'm sure our
me.
viewers did. Thank you. Really appreciate you coming on. I want to thank you for watching this episode of Medcastplus. I invite our viewers to follow us on social media, get in touch with us on Instagram. And my name is Dr. Jack Braha. You can find me on Instagram at GIJack. Visit us at medcastplus.com. Check out our tools. And you can also call us at 718-510-2103 for more information. Again, I'm Dr. Braha from all of us here at Medcastplus. Stay healthy.